So welcome to the summit. When my flight landed here in DC, sometimes the pilot stands out and says hello. And the pilot looked me in the eye and said, "Welcome to Cleveland." And it was really actually unsettling a little bit. So I had the thought, I could stand up here and say, "Welcome to this summit on pterodactyls," and just see if we caught anybody off guard. I want to start, for those of you who were here yesterday for the CBTN meeting, you will have seen some of these slides. I won't go into as much detail as we did yesterday, but I think for those of you who were not here yesterday or just would like a recap, we want to go through some of the resources that are available through the CBTN and just make sure everybody is aware of kind of the scope of this growing network, and also how to access those. I mean, I think the main goal of CBTN is getting the specimens and data out to researchers and to the community. And so it's great that it's growing, but it's even greater to see that it's being used. And we want that to be even a bigger part of what we do with CBTN each year. So these are the numbers, and you see the number of specimens is quite large at this point. At this point, it is the largest brain tumor data and specimen network, and that's across peds and adult. And the other thing to look at is the number of scientific projects. So I think that is really a testament to how much the data and specimens are already being used, and we expect that number to keep going up. And this is just in the last year, the number of sites that have been added on. Obviously, a very international network at this point. And some of the sites that were added on are really quite large children's hospitals. So we're very excited about what that means for the growth of this program. This is a relatively new addition that we wanted people to be aware of, is the uploading of MRIs and imaging from our patients. So this number is large and growing. And yesterday went through a lot of the resources that are going to make it even easier for researchers to get into this data. So, if you're thinking about projects that might have a radiological component, this will be easier, and you're going to have access to more studies with every day and every week. So this was a big successful jump in the number of samples that were able to be molecular profiled through these large federally funded programs. The XO1 was officially processed, and I guess that was a little bit what the shout outs for. That was a major push of this year. And then a recent proteomics XO1 was also awarded. So the data sets and the ability to ask and answer questions is just going to get larger and easier. And this was actually from Tatiana's presentation yesterday, but I liked how it really summarized the actual ways that researchers can access this data. There are a lot of ways to access this data, and I think for those of you who have, these are some of the most easily accessible and usable resources and platforms for data accessing for any type of oncology research. And we are fortunate that this is really motivated by these pediatric brain tumor samples. So just a quick shout out and a reminder that today we'll end with a poster session and cocktail hour. We had a really nice outpouring of abstracts submitted this year. We were excited about a lot of them. These were the 6 top scoring abstracts. And so these researchers will be presenting their posters later, and as well as many others. And so I guess we should just take a second and applaud these researchers who put in really great abstracts. I'm not going to speak for very long, but I wanted to go into this recent concept that we've been talking about in my lab. And as I put this slide together, I realized that this is a huge buzzkill of a statement to lead with for a precision medicine conference. But I think that what is the other way to look at this is, what can we learn from the efforts to target EGFR? It's probably been the biggest precision medicine effort in brain tumors to date, and probably the most amount of hours spent, resources spent on precision medicine. What can we learn from the experiences thus far. This was from a review that was recently published just this last month. And this is how I think my brain has wrapped around targeting a growth factor receptor, that you have a wild type that might be amplified, or you have a mutant form of that EGFR, and that might inform what drug you might choose, and you just take it from there and hope for the best. And we know now from EGFR that that was a really superficial understanding, and we have a much bigger beast that we're up against. And so this shows here in this schematic that when you have an EGFR driven glioma, that there is genomic instability that often leads to extrachromosomal DNA. And so here you see wild type EGFR, but you also see wild type EGFR on an extrachromosomal DNA. And both of those contribute to the amplification and the overexpression of this. Okay, straightforward, easy enough. It gets more complicated. EGFR then can be mutated, and here they show V3, which is commonly mutated in adult GBM. And to make it even more complex, that mutated EGFR or the wild type can be put into extrachromosomal DNA, and maybe some of one or the other. And what we now know is that depending on the variant that is in that extrachromosomal DNA, you may or may not respond to the EGFR tyrosine kinase inhibitor. So some drugs that are promising for CNS penetration may be very good at targeting EGFR altered glioma, but not wild type, or vice versa. And to make things even more complicated, this is not, even if you can wrap your head around that, this is not homogeneous within the tumor. This is for high-grade glioma, this is a heterogeneous tumor. And so each tumor cell within the glioma may have a different cocktail of mutated or wild type chromosomal EGFR altered, and your drugs may target just a handful of those. So we now understand this, and we realize that precision medicine for EGFR is going to be a lot more complex. What we can then learn from as a field is these same tools and tricks are often being used by pediatric brain tumors, and we now have the tools and resources in CBTN to tap into those. Lucas Chavez was honored last night for his work looking across pediatric brain tumors for extrachromosomal DNA. And so in short order, we're going to have a much better understanding of our tumors, and our next generation of precision medicine therapies will be that much more well-informed. So precision medicine, the things that are going to be, for us to be successful in the next generation, we're going to need to tackle data at multiple levels. Multimodal data. We're going to need to understand RNA. And RNA, bulk RNA, we now realize often is short of what we need to fully understand these tumors. So we need single cell RNA. We need to understand epigenetics, DNA methylation, proteomics, imaging, clinical data. We need all of these things, right? Fortunately, this is exactly how we've organized today's summit. So you are going to hear about all of these points with lunch spattered in the middle. And this is what we think, as those of us who are in the leadership at CB10 think it will take for us to be successful with precision medicine. By the end of today, you will be experts on all of these topics. I will leave with this Gary Larson ad, comic, which has been one of my favorites forever, and look forward to enjoying this day. Thank you.